is Jessica Martin, and I'm the Director of Special Education and Student Services for the RVA, and I also serve as the RVA's school psychologist. This is a PowerPoint about anxiety. The material is derived from the National Association of School Psychologists, but I modified it so that hopefully it's a valuable resource for you and your family. The definition of anxiety is an apprehension or excessive fear about something real or even imagined. It's normal for people to experience anxiety in some form, and it can actually be beneficial at times because it can alert us to danger and keep us safe. However, excessive worrying can be unproductive because it can interfere with our ability to take action, to solve problems, and even to learn. The first signs of typical anxiety are at about 7 to 9 months of age. And this is typically referred to as stranger anxiety, when an infant expresses some reluctance to go to an unfamiliar person or might cling to a parent. Another time that's like significant age for anxiety in a normal developing child is around 12 months of age. And that's where we see more separation anxiety, when a child will cry when their parent leaves or when they're with someone that they're not familiar with. School-age children above the age of 8 start to worry about abstract and less specific things, such as their grades, what their peers think of them, and school in general. Some kids can even start to worry about real-world problems at this age, but that's all considered to be in the normal range. We've probably all experienced anxiety at some point in our lives, and it can feel different and have different responses in our bodies depending on each person. Starting up at the top of the body, things such as headaches, sweating, tension, even a choking sensation, shortness of breath. Going further down in the body, chest pains, stomach pains, differences in appetite, that feeling of butterflies, problems with bladder or bowel movement problems, shakiness, feeling like your legs are kind of jello or feeling that pins and needles sensation. These are all symptoms and signs that the body is going through something that's causing anxiety. If you or your child notices these symptoms, they may be struggling with anxious thoughts and feelings, and it's helpful for you to know what these things are, so in case your child has trouble explaining what it is they're feeling, this can give you an idea of maybe what to ask, as a lot of times young children don't really know how to express what they're feeling. When anxiety is excessive and beyond what is normal for the child's age and their developmental level, social, personal, and academic problems can occur, which can result in what's called an anxiety disorder. Anxiety disorder signs are similar between kids and adults, but children often show more signs of irritability and inattention. It's estimated that 2 to 14% of children have anxiety disorders, and they occur more often with females. Now again, if your child shows some signs of anxiety, it might not indicate they have an anxiety disorder. However, when it's beyond what is considered normal for their age or developmental level, and they're having problems, whether it be social, personal, or academic, this can be then considered an anxiety disorder. The most common kinds of anxiety disorders are detailed here in this slide. There's separation anxiety disorder, which is an excessive clinging to caretakers. Generalized anxiety disorder, which is an overall excessive worry and anxiety that goes across a variety of situations. Post-traumatic stress disorder, which can occur after a traumatic event and can include flashbacks. Often we hear about this from our soldiers returning from wartime. Social phobia disorder is an excessive fear and anxiety about social situations. Often people with social phobia disorders become really anxious in large groups and crowds. And then there's obsessive compulsive disorder, which is repetitive thoughts that are difficult to control, that are considered obsessions, and or the need to repeat specific acts, which are called compulsions. So that can be either part of that diagnosis. There are other problems that are related to anxiety as well. Depression is a problem that occurs with anxiety about 50 to 60% of the time. And what's scary is that if anxiety is left untreated, it can actually lead to depression. So if you have significant concerns about your child's level of anxiety, make sure to have those concerns addressed, because depression is then another problem that can occur and be difficult to deal with at a later point in time. ADHD, or attention deficit hyperactivity disorder, is related to anxiety because often the two problems are confusing diagnoses. So anxiety is often misdiagnosed as ADHD. As I had said in an earlier slide, anxiety disorder symptoms are similar with children and adults, but children often show more signs of irritability and inattention, which can look like ADHD. Anxiety can also lead to or be related to school performance issues. A student may be forgetful, inattentive, or have a difficult time completing and organizing work. But on the other token, a student with anxiety can also be overly perfectionistic and be very rigid about how they do their work, how they organize things, and have very high expectations about how they do in school. Substance use is another related problem, as substance use and abuse can often look like anxiety. Some of the problems that are associated with substance use and abuse are sleep problems, inattention, withdrawal, and reduced school performance. So how do you know if your child needs professional help? Well, I've come up with these questions to help you answer that. The first is the anxiety typical for my child's age? Is the anxiety shown in specific situations, or is it more pervasive? Is the problem long-term or recent? What events may be contributing to the problems? And how are personal, social, and academic progress affected? If in answering those questions you've determined that the anxiety is not typical for your child's age, is long-standing, does not seem to be improving, and is causing significant problems, it is probably best to talk with a professional. Counseling, whether it be individual for your child or for your whole family, can be beneficial. There are a number of medications on the market as well that can be helpful to help with the symptoms of anxiety and dealing with the situations that cause anxious feelings. There are definitely things that you can do to help, and so I wrote this slide out with a lot of detail because it's very important if your child is struggling with anxiety. Be patient and prepared to listen. Be consistent in how you handle problems and administer discipline. Maintain a consistent but flexible routine for homework, chores, and activities. Maintain realistic and attainable goals for your child. Praise and reinforce effort, even if success is less than expected. Try to increase your child's confidence in what they are worrying about. You can do this by practicing for an upcoming speech, or even do some role playing with social interactions that bother your child. Teach your child simple strategies, such as organizing materials in time, having scripts of what to do and say, and practicing some deep breathing to help them relax in stressful situations. Listen and talk with your child on a regular basis and avoid being critical. Do not treat your child's emotions, questions, and statements about anxiety as silly or unimportant. Do not assume that your child is being difficult or that the problem will go away. Seek help if the problem persists and continues to interfere with daily activities. As I mentioned earlier, untreated anxiety can lead to depression and other problems that can persist into adulthood, so definitely use your resources. Help your child learn to cope with their anxious feelings, and don't be afraid to discuss your concerns with your RBA teacher or with myself. Visit the ruralvirtual.org faculty page for a list of email addresses for the teachers that are involved in the RBA, as well as for my contact information. All the staff that work at the RBA care about you and your child and we want to do what we can to help your child be more successful. So please use us as a resource if you need to. Thank you so much.